As you age, your teeth age too. Decay, fillings, trauma, or even just normal chewing habits can make your teeth break down over time. A dental crown, or a cap, is a cover that is placed over a tooth to protect a weakened tooth from further fracturing or deteriorating. A crown could also be used to replace a discolored or badly shaped tooth or protect a tooth that has had a root canal. Lastly, a new crown is necessary to simply replace an old worn-down or defective crown.
Hi, it's Dr. Kenny Levine with Health Talk. Welcome back. I'm here with Dr. Eli Friedman. Eli, we left off talking about implants and relationships to removable dentures. Today, there are cases that we do together where there's somebody who has a removable denture, and by placing some implants, we can stabilize that for them. Isn't that correct?
Correct. And that's one of the magical things about dental implants. We have the ability to do something simple like just stabilize a denture that a patient has that's ill-fitting, that they struggle with, that can be a simple attachment system where it just kind of clicks into the denture, as you know. The other option is we can convert those patients to something more permanent with a just fixated type of case where we can actually give them their function and their permanent teeth in one day. In fact, as you know, in certain cases we can actually do that, which is quite impressive, things that we didn't know that we could do many years ago. We also kind of can get away with traditionally using less implants that we at once upon a time thought we needed to have a certain number of implants. Now we can use kind of a lower number, knowing that studies are showing that they're just as effective in holding teeth with fewer numbers.
You know, things change. I've been doing implants since '85. Let's shift gears for a second and talk about cosmetic dentistry. Would you describe for our viewers, the difference between cutting down a tooth for a crown, what a veneer is, and what bonding is? Because that's really important today.
Yeah, I think that a lot of people come into my practice asking that because everybody sees what is a veneer, what is a crown, what is bonding, and quite simply put, bonding is when the dentist takes a material and can cure it with a light directly in the mouth. It hardens, it sets, and then that can be carved in shape to kind of conform to the missing tooth structure or cosmetically enhance the patient's tooth. A veneer, by definition, and a crown, for all intents and purposes, is basically a similar restoration. However, a veneer, by definition, only covers the front part of the patient's tooth.
So like a false fingernail.
False fingernail, exactly.
How do you make the decision as to which of those restorations your patient needs?
You know, firstly, we have to look at what's involved in the patient's case, how advanced the case is, how much tooth structure is missing, and most importantly, make that decision in conjunction with the patient. You know, oftentimes I will directly involve my decision process with the patient when we can get away with bonding. We'll sit and we'll see if that's an option for a patient. With veneers or crowns, we have the ability to fabricate the restoration, of course, outside of the mouth. And that's a huge advantage in cosmetics because we can create advanced layering techniques and kind of mix and match porcelains to get a more cosmetic result. Certainly bonding can be cosmetic, and it is cosmetic if it's done using advanced and good bonding material.
You're a little bit limited in what you can accomplish.
You are, because it has to be done directly in the mouth. You don't have the ability to necessarily change it once it's done, and then bonding, of course, comes in certain shades, and oftentimes you can mix those shades, but it doesn't have the diverse colors, structure, and scheme like porcelains do, of course.
So patients today want white fillings.
They want white fillings.
They don't want the old amalgam restorations that were put in for the past 100 years. They don't want the margins of their crowns to show. How do you make a decision relative to porcelain, all porcelain restorations, or porcelain to gold restorations?
Well, most of the time, the decision is most of the time made either by the existing restorations they have in their mouth or by the location of the restoration. Oftentimes in the front of the mouth, we can get away with all ceramic crowns and restorations. Some of the newer porcelains hold up very well in all ceramic restorations. We can also do zirconia-based restorations, which is a substructure that is very strong. You know, if you take a zirconia-based structure, which is almost in dentistry they call a white metal, that holds up very well. And the biggest concern that most patients have is not immediately when the restoration is placed, because you can make a very nice restoration that has a metal base to it. However, It's when the gum line, oftentimes, as you know, as a periodontist, starts to recede a little bit, and you see the margin, the kind of gray halo that happens, and people don't like that too much.
Well, I don't blame them. I don't like it either. We're going to talk about what we can do together to prevent that. It's Dr. Kenny Levine with Health Talk. We'll see you in just a moment. Thank you.
When a tooth requires a crown, it has already been weakened to the point that it may not be strong enough to support a filling. Using an unsupported filling instead of a crown often causes the tooth to fracture beyond the point of repair.